today is a continuation of the full CBT course that I'm doing. So I started with the NMC Code of Conduct, where I'm explaining the basic concept of the code and how you can apply those concepts in your exam. So if this is your first time, kindly do well to check out the previous videos and just follow through. This is the episode 4. Today I'll be discussing preserve safety, which is another core principle or core theme of the NMC Code of Conduct. All right, so if you look at the preserve safety, it basically talks about making sure that you don't put public and patient safety at risk, and you practice within your limit of competence, as well as making sure that you report things that put patient and public safety at risk. So as usual, you get a preamble as you can see on your screen, so which talks about you make sure that patient and public safety is not affected. You work within the limit of your competence, exercising your professional duty of candor, and raising concerns immediately when you come across situation that puts patient or public safety at risk. Then you must take necessary action to deal with any concerns where appropriate. So one aspect that I want to throw more light on is the duty of candor. Okay, so your professional duty of candor, that is anything that happens in the line of patient care. Is maybe you make a mistake, or maybe there's any harm to patient due to maybe certain negligence that you did or whatsoever. Under the professional duty of candor, you are to what? Tell the patient what happened and apologize for the harm that was caused, or maybe the potential harm that could have been caused. So professional duty of candor is basically you being honest and candid with the patient at all times, even if you make a mistake. If you look at the 13.12 and up to 5, it lines certain things that you are supposed to do to demonstrate that you are preserving safety under the heading of recognize and work within your limits of competence. Now, if we say work within the limit of your competence, what we mean is whatever you've not been trained to do, you shouldn't do it. Okay, even if it's an emergency situation, and maybe you have the idea that you are doing it to preserve patient life. The idea is you might try to do certain things, bearing in mind that you are protecting the patient, or maybe you are preserving life. However, if you are not trained properly, you can do it and rather put the patient at risk more. So that is the idea of it. Is it? You might get questions where they might try to trick you with these emergency situations where you are supposed to do something but you've not been trained. So watch out for these kind of questions and scenarios. So do only things that you've been trained and you've been assessed as competent to do. Then make sure that you refer matters to other colleagues who are professional within that field. If something does not fall within your scope of practice, make immediate referral to another colleague who has that specialty. Then take account of your own personal safety. That is because you are rendering care to other people doesn't mean that you should put your own life at risk. Before you assess any patient, or maybe you attend to any situation, make sure that the scene is safe for you as a nurse to render that care, and also safe for the patient as well. Then complete the necessary training before carrying out any new role. If they assign you of any new role, make sure that you've been trained to carry out that role. So that is one aspect of the preserving of safety, that is working within the limit of your competence. The second aspect is about the duty of candor. So if you look on your screen, 14.1, 14.2, 14.3, It's basically talking about the duty of candor. That is, be open and candid with all service users about all aspects of care and treatment, including when any mistakes or harm have taken place. So, mistakes, maybe drug error, patient was prescribed maybe paracetamol, you've gone to administer something else. That is a mistake. When that happens, make sure you inform the patient, okay, that this is what happened. And there are three things that will go under duty of candor. So the first one is act immediately to put right the situation. So maybe if it's an infusion and it is still in place, make sure you put it off. Okay, so that is you putting things in the right word situation. Then two, explain fully and promptly what happened, including the likely side effects. So tell the patient that maybe I was supposed to do this and I've done this what mistake, and because of that maybe you might get this what reaction. So whatever will happen, just explain to the patient, then apologize what to the patient. Now once you do this, it gives room for what trust. The patient will trust what the nurse. That does not guarantee that there wouldn't be any legal consequences on that behalf. No, it is just your duty to be what honest. Then document this event what formally and take further action. That is escalate. Escalate means to tell someone who is what above you. So whenever it happens, you also have to document exactly what happened, the action that you took, and the consequences of everything that has what happened, so that it can serve as a learning curve for others as well. So one of the most important reasons why we document these things is what to learn from these mistakes. Always offer help in an emergency if an emergency arises in your practice setting or anywhere else. So emergencies can happen anywhere. You might be at home, you might be in the community, wherever. If that happens, as a qualified professional, you have to what? Offer help. However, it should be on the condition that you are practicing within the limits of what your competence. That is, you're only doing things that you know and you are qualified to do. Okay, so maybe you're a nurse, there's an issue of labor, you don't know anything about it, please don't go and deliver the baby. That is it. Then arrange wherever possible for emergency care to be assessed and provided promptly. So you can assist by calling 999 111. These are what emergency care services. Then take account of your own safety, the safety of others, and the availability of other options for providing care. So don't put your life at risk trying to save what others or being a hero. However, what you can do is if there's other available services that can be much of help at that point, make sure that the person has access to what these things. Calling other bystanders, calling 999, as I've said, these are all what available options for what providing care. Act without delay if you believe that there's a risk towards patient safety or public protection. That is, if you believe, okay, that is anything that you think it has the potential to cause patient safety at risk, put patient safety at risk, you have to, what, to raise concerns. It can be maybe under staff. Okay, maybe we're supposed to be three people on a shift and one person didn't come. Okay, it means you go understaffed at that point, and that is something that can put patient safety at risk. So make sure when these things happen, you have to what ring your line manager or tell the person whoever is in charge at that point. Another important aspect of this is safeguarding vulnerable people. So if we talk of vulnerable people, example is pregnant women, children and elderly people. That is people who are at risk of abuse and or neglect. So make sure that these people are well protected. So your duty is to observe for any signs of war, abuse and neglect within these vulnerable groups and to raise or share this information as quickly as what possible. It should be very, very immediate because these people need to be protected. Now, when it comes to cases of safeguarding, there is no issue of confidentiality, or confidentiality does not come in, because we need to share that information to protect the individual as a patient or the public as a whole. So for that regard, there is no breach of confidentiality. The section 8 talks about medications, that is administration, supply, and prescription of medications, and the rules that covers this part. So the most important thing is, before you can prescribe or you can administer or supply any medication, you should have the necessary qualification to do so. That is, you should make sure that you are being trained to do what so. Other than that, there's no way you can carry out these procedures, or you can do these things. And one thing is, you should have necessary information about the medication, the side effects. That is, you know what the medication is for, and everything that covers medication and how best it can help the patient. And lastly, it is also important that, for the best of your own interest, you don't prescribe medications for your relatives or people that you have close relationships with. And it is also your duty to make sure that medicines are stored what securely and properly. It means that it should be kept at a place where people who don't have authorization will get access to. So these are your roles and duties, covering administration, prescription, and dispensing of medications. And the most important that I've talked about is, you should do all these things within the limit of what your competence, and be aware of and reduce as far as possible any potential for harm associated with your practice. So this has to do with employing means, services, and ways to reduce the likelihood of you making mistakes. So it can come from you, the individual, or come from the organization itself. And for you as an individual, you should be able to work within your capability. That is, if you are being stressed, it means you should take some time off, because you being stressed can cause the problem of you making some mistakes. Then, in addition to that, the organization should employ services or maybe new technologies, new ways to improve what services. That is, if there's a new software, there's a new program that can improve on the way staffs go on with their work, with the aim of reducing the mistakes, near misses, and all that. The services or the organization should be able to do this. And you, in particular, if there's a new service or a new way to reducing risk, you should be trained in that one and employ those ways or those techniques. So that brings us to the preserve safety aspect of the NMC code of conduct. So today we've discussed about professional duty of candor, what it means, and your role as a nurse in case you make a mistake with patient care. We've talked about practicing within the limit of what you're competent. That is, if you've not been trained to carry out a specific procedure, you shouldn't worry yourself doing that in the first place, even if your intention is to save patient life. Then we've talked about reducing the likelihood of mistakes in your practice, and in addition, that is you also protecting what the vulnerable individuals within the society or within the community or wherever you find yourself in. And above all, we've also talked about you reporting any incident or anything that poses patient safety what at risk. So anything, and that reporting should be done what immediately. So the underlying word that I keep using is the immediate aspect of it. You don't have to wait longer. It should be what immediate, because you delaying might put patient safety at risk.